Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Nasal saline drops for babies. How to give in right dose. A blocked nose is one of the most irritating episodes for adults. Think about young babies. Nasal drops are safe in clearing a blocked nose. What are nasal saline drops? Saline drops made for the nose are a proper mixture of water and salt. Putting a few drops of this solution in your baby's nose can help clear any blockage. It provides quick results and is affordable. How to give saline nasal drops to babies. 1. Wash your hands thoroughly. 2. Fill the dosage as recommended in a syringe or a dropper. 3. Hold the dropper in your dominant hand and use the other arm to hold your baby. 4. Clear the mucus present outside first using a small suction bulb. 5. Do not insert the dropper in your baby's nose. Place it just outside the nasal cavity and squeeze it. 6. Continue holding your baby for the solution to travel down the blocked track. 7. Sometimes, the solution can reach the throat and cause your baby to cough. Hold him up in a sitting position when this happens. What is the recommended amount of nasal saline drops for babies? Start with a drop or two in your baby's nose. If all seems okay, you can administer nasal drops 1 to 2 drops per nostril, twice a day. Avoid giving more than this amount, as it can irritate the nasal passages and worsen your baby's condition. Side effects of using saline nasal drops or sprays for babies. 1. Sharing the same dropper amongst several people without sterilizing it can invite infections. 2. Nasal drops given more than 3 times a day can make the nose sore. Precautions to consider while giving saline drops. 1. Wait for 15 to 20 minutes after administering nasal drops to feed your child. 2. Sterilize the bulb, dropper, and any other equipment after every use. 3. Do not give your baby nasal drops more than 2 times a day. 4. Do not insert the dropper too far up your baby's nose. 5. Don't use nasal drops with any other medication unless prescribed by a doctor. 6. Please follow if the doctor has prescribed a certain type, frequency, or amount of nasal drops. Is it safe to give saline nose drops to a sleeping baby? No, your baby should be awake during this time to prevent any mishap. Nasal drops are quick and effective and can relieve your baby from the trouble, bringing him back to the playful mood he loves to be in.